Hello, good day everyone. Welcome to Your Health Today with Dr. Ide. I am Dr. Laide Jinodu, and we're talking about something fun today. We'll be talking about the common misconceptions about your health. So misconception number one would be abortions versus miscarriage. Now, I got accused by a patient once. She was really upset with me because I said she had an abortion. She said, I'm a Christian. I don't do abortions. We don't do abortion. It's a sin. And I had to make her understand that when we say abortion, it's simply termination of pregnancy. Whether it happens spontaneously, whether it happened inevitably, whether it was a threat, whether it's a miscarriage, they are all abortions. Okay, so please don't get offended whenever you hear the word abortion from the mouth of a doctor. It doesn't mean a D&C, that's dilatation and curettage. It just means termination of pregnancy. Misconception number two, the word infection versus STI. STI means sexually transmitted infection. Now, when a doctor mentions the word infection, or an healthcare professional talks about infection, the first thing that comes to our minds is a sexually transmitted infection. Let me prove that it's wrong. The word infection is a blanket statement for presence of bacteria, fungi, or virus in the bloodstream, which is not normal, so that's that. So don't be offended whenever anybody mentions infection. Just listen to the doctor and ask, okay, infection of what part of the body? Okay, you could have infection of the respiratory tract. An example is pneumonia. You could have an infection of your digestive tract, gastroenteritis, food poisoning, typhoid enteritis. You got an infection of the brain, that's meningitis or encephalitis, an infection in the urinary tract system, urinary tract infection. So we have infections caused by different agents, bacteria, viruses, or fungi in different parts of the body. Okay, now misconception number three, very interesting one: hypertension versus BP. At times I ask patients, ma, are you hypertensive? Sir, are you hypertensive? Say, no, God forbid, oh. I just have small BP. That's all, small BP. Hypertension is the same thing as elevated BP. Alright, so misconception number four: diabetes mellitus versus high blood sugar. It's the same thing. You talk to some people and ask them, are you diabetic? God forbid, oh. No, me, I'm not diabetic, oh. Just blood sugar, small blood sugar, and sorry to burst your bubble, but it means the same thing. Okay. Misconception number five, very funny one. I find it difficult to comprehend when you tell some people, you ask them, have you had any surgery before? And say, no, God forbid, not my portion. No, I just had small operation. They operate me in my appendix. Surgeries are the same thing as operation, surgical operation. So please don't be offended when you hear surgery, operation. They mean about the same thing. Okay. Misconception number six: CS versus other surgeries. I had a man tell me once that they do me CS. I had a CS on my leg. They removed the bone there and put metal there. So a CS means a cesarean section. It's a surgery that entails the opening of the lower part of the belly and bringing out a baby. It's strictly meant for bringing out babies from a pregnant woman. So the word CS doesn't mean surgery, it just means a particular kind of surgery. So please stop misconstruing cesarean sections for other kinds of surgeries. Thank you very much. So that will take us to misconception number seven. Very funny one. Drugs versus injections. Now let me tell you something. A lot of us think that drugs are tablets, but that's wrong. Anything taken or given to improve your health is a drug. Be it a tablet, be it an injection, they are all drugs. So don't confuse both of them, okay? So I'll stop laughing, but it's quite funny, you know. Another one, misconception number 8, stomach pain versus abdominal pain. Now let us know that your stomach is not at the center of your belly. Your stomach is actually underneath your heart, somewhere here. So when you point at this place, it's not stomach pain, you know, it's abdominal pain, abdominal discomfort, okay? So these are common misconceptions, okay? Tummy ache, you know, abdominal pain, not stomach ache. Your stomach is here, okay, not down here. These are your intestines, okay? All right, then our last misconception for today will be C-class. Now I'm going to take some time with this. Now when we say C-class, we are talking about people who have the sickle cell disease. Now they are called C-class not because they fall sick often, but because their red blood cells have the ability to turn into a sickle shape. That's like a C. This cutlass that looks like a C used in harvesting rice, that's a sickle. Now their red blood cells become sickle shaped whenever they go through oxidative stress or dehydration or anything, you know, or poor oxygen concentration. You know, when they get hypoxic, that means low oxygen concentration. Their red blood cells, which is supposed to be like a disc, becomes sickle shaped, like a moon, like a moon, you know, the normal moon shape and all that. Okay, fine. So they are called sicklers, sickle from the word sickle, not because they fall sick very often. So please, let's correct these misconceptions. If you just like this video, I would have you like the video, share, tag your friends, post your comments, and please don't forget to subscribe to my YouTube channel. Thank you very much. God bless.